It was just a small rear-end collision, a tap on the bumper. Dr. Mark Frobb is a pain management physician, a chronic back pain specialist, and an author. His newest book is called Surviving Whiplash, Saving Your Neck Without Losing Your Mind. It is my pleasure to welcome Dr. Mark Frobb to Studio 4 to tell us more.
Thank you, Fanny.
Nice to meet you. Well, what you don't know can hurt you when facing whiplash, that's for sure. What is whiplash?
Well, whiplash is an acceleration-deceleration injury that occurs to the spine. And essentially, it's something that occurs very, very fast. It's all over in 300 milliseconds. So as fast as you can blink your eye, it's a done deal. So there's really nothing you can do to mitigate the injury. It's going to happen in any case.
Well, we've heard the term a million times, and many people claim they have it, and others say, no, you don't. That's not real whiplash.
Well, whiplash occurs actually in two phases, and if we can look at Wee Wilbert here, we can demonstrate that.
What's his name?
Wee Wilbert.
Wee Wilbert.
That's right.
Well, we can look at Wee Wilbert if you like.
Now, there's two phases to the injury. The first thing that happens is when you get hit with a vehicle, the large torso moves forward, but the head stays in position, so you get a hyperextension.
Okay.
The second part is that the head and neck whip forward at 2.5 times the speed of the collision, so by creating the injury.
And that is a neck.
And that is a neck. It's a very delicate apparatus. So if you look at the physiological tolerances, we talk, for example, to get some perspective on it, 3 Gs, gravitational force, is what we normally use when we talk about these forces. So 3 Gs is the maximum that you can have in an amusement park ride. It's less than what the shuttle launch has and its takeoff. Mm-hmm. And essentially in jet fighter pilots and planes, you have to get the plane checked out if you exceed 3 Gs. Well, 4.5 Gs is the physiological tolerance of the soft tissues before you start getting shearing and tearing. That can occur at 6 to 8 kilometers in a rear-end collision. Very, very
6 to 8 kilometers.
That's
Can
right.
you get whiplash? Whiplash? Whiplash?
Whiplash?
That's French. Can you get whiplash stepping off a curb?
Well, stepping off, if you got jarred and you were very frail, but you can certainly get it in sporting injuries, skateboarding, falling off a skateboard, snowboarding. The Corey Koski story, which has been in the news, or the professional baseball player who fell back, never struck his head. He got a very severe whiplash and, in fact, ended up getting a concussion and minimal traumatic brain injury, which is another myth that is in whiplash injuries, that you cannot get a concussion with a whiplash if you don't strike your head.
But you can.
You can.
You can. Okay, so the symptoms are?
Well, the most common presentation is pain, of course. That's what makes everybody go to the emergency room.
Right. Pain where?
Pain in the upper back, the neck. It may radiate to the arms if there's nerve injury. So pain is what drives people there. But there are, as Surviving Whiplash puts out, it's a composite injury. Mm-hmm. You also may experience, as we talked about, a concussion. 1 in 4 people who have whiplash may have an associated post-traumatic stress disorder. So pain is the encompassing thing that drives people to the doctors, but later on, they have to recognize that there's many other manifestations of this problem.
If you're in a rear-ender, does the pain come immediately? Can it come a week later, 6 months later?
Well, if you have pain immediately, that's a poor prognosticating sign. But the injury will certainly develop in most cases within 72 hours. But in some cases, you may have symptoms that develop up to 2 to 3 weeks later, which will be gradual in onset.
Muscle, ligaments, nerves, bone, all of that?
All of them are involved. And in fact, in treatment of it, that's why it's also a very difficult problem, because it's marked by idiosyncrasy. What works in one person doesn't necessarily work in the next. And the reason for that is there's many different pain generators. As you can see, there's the core and then the joints, but on top of that there's concentric layers of muscles and fascia, all of which may be torn or injured in the course of the injury.
How do you test somebody to know whether or not they have whiplash?
And that's a bit of a problem. Certainly the clinical examination will demonstrate pain and loss of range of motion.
Right.
But the tests don't show much. So x-rays will be fine, MRIs may be fine, and you're not going to see the damage that's done, because it's a deeper damage, it's in the muscles itself.
As a patient, it's very difficult to deal with denial, denial, denial. Someone says, you don't have it. And you say, but I hurt. Someone says, you don't have whiplash.
And that's the problem, because when you're dealing with an insurance company, they've adopted what is called minimal impact soft tissue disorder. In other words, no crash, no cash. And what most people don't recognize is it takes up to 16 kilometers an hour rear end before you see visible damage to the vehicle. Even though at 13 Gs, you've now, for example, a 100-pound female may have experienced 800 pounds of vector stress to her body. So if you take